Welcome to another day virtual learning experience with My First Step. At the end of this video, you'll be able to identify the parts and functions of the skeletal and muscular system. A human being has 206 bones that serves as framework of the body. These bones are of different shapes and sizes. There are long and short bones. They support the weight of the body and protect some of the delicate organs of the body. All these bones make up the skeletal system. The skeletal system is subdivided into two categories. The axial skeleton. The axial skeleton protects the delicate organs of the body. The axial skeleton includes the skull, the vertebrae, and the rib cage. The appendicular skeleton, on the other hand, provides support and aid movements. The appendicular skeleton includes the upper and lower limbs. The skull helps protect the brain. These bones are called the cranium and the facial bones. The backbone protects the spinal cord. It composed of 33 small bones connected to one another. It enables the body to have an erect posture. The pelvic bones or hip bone support our body when we sit. The chest is made up of 24 ribs and sternum. The ribs form a cage that protects your lungs and heart. 10 pairs of ribs are connected to the sternum. 2 pairs are not connected to the sternum, and these are called the floating ribs. The joints. Ball and socket joints are the ones found in your shoulder and hip joints. Joint is where two bones meet and connect. The saddle joint. The saddle joint allows back and forth motion as well as up and down movement, but does not allow rotational movement like in a ball and socket joint. The head is connected to the neck by a pivot joint. This joint allows limited movement. The ends of the bones that meet are coated by a fibrous material called cartilage. It serves as a cushion for the joints or bones when you move. Cartilage is a good shock absorber. Ligaments. Ligaments connect bone to bone. Ligaments enable bones to move in the directions allowed by the joints. Tendons. Tendons are tough elastic tissues that connect muscles to bones. The stapes or stirrup is the smallest and lightest bone in the human body. It is found in the ear. Let's study the parts of the skeletal system. Different bone diseases. Scoliosis. Scoliosis is the abnormal sideways curvature of the spine. This can cause back pain. Arthritis. Arthritis is an inflammation of the joints commonly affecting old people. It occurs when joints become stiff due to wearing away of the cartilage. Rickets. Rickets is characterized by lack of vitamin D. A person who has rickets does not get enough calcium in the bones, making the bones weak. Osteoporosis. Osteoporosis is characterized by brittle and weak bones. This is because of inadequate intake of nutrients needed in bone development. Common bone injuries. Fracture. A high impact force on the bone may cause it to break. So a fracture is a break on a bone. Sprain. A sprain occurs when too much pressure is put on the joint and the nearby bones and ligament. Dislocation. A dislocation occurs when severe pressure is put on the joints, forcing the bones to move out of alignment. How the skeletal system works with other systems of the body. Organs work together as part of a big team. The bones are inside our body. The bones cannot move by themselves. The bones can move because of the muscles. The muscles make the bones intact to its proper places. The bones and muscles give the body shape and form, and help us move and do different things. The bones have three important things to do to our body. First, it allows the body to move. Second, it protects the body's sensitive organs, and lastly, produces blood cells in the bone marrow. The muscular system. There are about 650 muscles which give shape and form to the body and perform different types of movements. Muscles are made up of bundles that become short when they contract and return to their normal length when they relax. There are three kinds of muscles. Skeletal muscles. Skeletal muscles are those attached to the bones. These muscles help the bones move together and also give shape to the body. They are attached to the bones by tendons. Skeletal muscles are also called voluntary muscles. You can make these muscles move when you want to move. Smooth muscles. Smooth muscles line the walls of the internal organs. They are not attached to the bones. The muscles in the stomach, diaphragm, and the walls of blood vessels contain smooth muscles. Smooth muscles move all the time and cannot be controlled. They are also called involuntary muscles, meaning you cannot stop them from contracting even if you want to. When you eat, the chewed food is pushed by the rhythmic movement called peristalsis of the smooth muscles of the digestive canal. The diaphragm is also an example of a smooth muscle that allows you to breathe even when you are asleep. The cardiac muscle. The cardiac muscles are found only in the walls of the heart. They are also involuntary muscles because the heart can beat by itself without you controlling or thinking about it. Common muscle diseases. Trigger finger. Trigger finger happens when fingers locked in bent position because of the tendons are inflamed. Trigger finger is caused by repeated movements or forceful use of the fingers. Cramp. A cramp is an uncontrolled and painful contraction of one or more muscles. It can happen after a strenuous and repetitive activity, especially when the person sweats heavily and loses a lot of body salts. Muscular dystrophy. It is an inherited disease that weakens the muscle over time. It is a dangerous illness because not only skeletal muscles are affected. After some time, even the muscles of the heart and other internal organs slowly stop functioning properly. Tendinitis. Tendinitis is the inflammation of the tendon. Incorrect posture and poor stretching or poor conditioning before exercise or playing can lead to tendinitis. Did you know that the most hardworking muscle in the body is the heart? It does not have as much as power as the other muscles, but it works continuously over a lifetime without stopping. How you can take care of your muscles? Exercise regularly. Bending and stretching the muscles make them strong. Have a proper diet. Foods rich in protein like fish, meat, eggs, and dairy products make the muscles healthy. Have a proper diet. Drink milk and eat nutritious food like cheese, green leafy vegetables, and foods rich in vitamins C and D. Get enough rest and sleep. They help the bones build up energy and mass to stay strong. This is one way you can take care of your bones. Another way of taking care of your bones is to observe proper posture. The body should maintain a good posture when walking, sitting, or standing. That's all, and see you in our next virtual learning experience.